Good afternoon. Another question posted on the internet in regards to the minimally invasive bunionectomy. The question is, can it be used for revisional bunionectomies if the patient has had bunion surgery in the past, even up to 20 years? The answer to that is yes, certainly. The Peabody bunionectomy with the lamb modification can be used for revisional bunionectomies, and I'll show you a case about this later on. As long as the patient does not have arthritis in the big toe after their bunionectomy, their initial bunionectomy, it can be revised. I've done a significant amount of those recently from people that have had bunion surgery as far out as 20 years to as little out as less than a year. So definitely you can avoid the complication and additional scarring of a traditional bunionectomy. And if you're afraid of the revision, this minimally invasive technique can be used for revisional bunionectomy, given that the only criteria is you do not have arthritis in that big toe joint. If you do, then you would require the joint fusion. Now the question is, what is a joint fusion? A joint fusion is when a doctor goes ahead and takes away the cartilage of the toe joint right here, takes away the cartilage here, make it bone on bone, put plates and screws through it so we lock up the joint. The best way I say it is we set it and we forget it. Now that is the I would say the gold standard for people with arthritis of the big toe, whether it's via a failed bunionectomy, improper bunionectomy, or just a recurrent bunionectomy. That is typically the choice, or even a very severe bunion. Now every surgeon has a different way to attack the bunion. So as far as for the Peabody method, the minimally invasive 5mm scar method, it can be used for people with previous bunion surgery. Again, as little as a few months ago to as many as many decades ago, where I am and I have been able to fix those with significant ease with very minimal invasive surgery. Now let's look at a real life sample. This is a patient. If you notice the screw in the big toe on the right hand side, she has pain from the screw. About 20 years ago she had this bunionectomy done. So went ahead and considered for the Peabody bunionectomy. Here you go. This is immediately right after with the wire in place with the fragment moved and shifted over. And now we're going to see the post-operative view. As you can see, the reduction has been in place. There's no collateral damage. There's no very minimal swelling, and the patient is very happy with the results. Thank you for visiting us, and check out my other videos.